All right, welcome to Ask Dr. Jason. It's a beautiful sunny day in Los Angeles, California. I'm Dr. Jason, everybody's favorite chiro, and we're coming to you live with tips on health, healing, and alignment because a lot of people have questions on alignment, whether it's chiro care, whether it's healing, health. And so we've got a couple of questions today. We'll be taking some from Instagram as well. So go ahead, Bridge, and what is our first question?
All right. Hi, my name is Jess Brown. I found you on YouTube. I love your videos. However, I have a question for you. You may not know the answer, but worth a shot. I have a bad right ankle. Off and on now for 8 weeks, but I get the pain every 3 to 4 months. Went to see my doctor and she told me to get x-rays. So I did, it came back clear, but I still get the pain. And when the pain is back, I fight through it as I hate taking painkillers and they don't help. Do you have any ideas what I should do next? I've tried ice and the rice method, they didn't work. I feel something to do with my meniscus, but don't know, I'm not a doctor. Any help would be great.
Excellent. So she's got a right ankle problem?
Yes.
Okay. So my dear Jessie, I'm sorry you're hurting. Many times we injure our ankle, we injure our knee or our hip because our lumbar spine is out of alignment. What happens is the nerves going down to the hip, the knee, the ankle are not firing correctly. The muscles then are not at 100%. You put stress and strain and pressure on them, and then what happens is those muscles aren't firing. The joint can only hold so much with just the ligaments. You stretch, you strain, you hurt the muscles, you injure the soft tissues, you injure the joint, the bone, the cartilage, the ligaments. And so you need to oftentimes correct that problem with the wrist, the ankle, etc. But you've got to really get that brain to body connection. So a proper chiropractic evaluation is critical. If it's, an emergency situation, medical care, phenomenal. If you're looking for active rehab or even prehab, you want to get chiro care. You want to try to find a doc that specializes in sports rehab, muscle balancing, that type of thing, and it's a great extremity adjuster. So I would definitely get it checked out. Definitely, you're using the rice, rest, ice, compression, elevation. That's great. Continue doing that. But see, many times people use rice, rest, ice, compression, elevation. They use, I'm clean eating, I'm taking, omega-3s for anti-inflammation. But if the nerve supply is not there, you just won't get the proper healing. So you've got to have the proper diet, the proper rest, proper exercise or rehab, the proper alignment, and the right mindset to heal. Next question. Thank you.
All right, dear Dr. Jason, first off, let me start by saying I absolutely love your content. I'm a medicine, dentistry-oriented student.
Excellent.
That's how they call it here in Italy. I was wondering, since I started training back at the gym, I often feel the urge to crack what I think could be sternocostal joints.
Right.
Which I do by elevating my arms up and stretching my neck far to the back.
Okay, so he's going like this, going like that, popping the sternocostal joints.
Sometimes I do really feel the need to do that as I feel a weight in my chest. What could be the cause?
That's a great question, very common. Sometimes people do that or they stretch out behind. That is a sign that your thoracic spine, your mid-back area is out of alignment. You've got 12 ribs on either side. They go from the vertebrae in the back around to the front. There's a couple floating, the rest attached to either cartilage or directly into the sternum. If your thoracic spine is out of alignment and stuck, subluxated, those ribs cannot move properly. They're going to feel stuck as well, and because you're maybe not aware of the spine in that regards, you try to move the ribs because we have to breathe, we've got to move. We're humans, movement is everything. So what you want to do is see a chiropractor. If you're in Italy, I've got a couple of friends there. Let me know what part of Italy you're in and I'll direct you to the right guy or gal. Otherwise, definitely get chiro care. You probably notice the urge for that go away. Thank you. Great question. Next one, please.
Next one. Hey doc, I don't know if you're going to see this, but I hope you do.
Come on.
I just got an MRI that said I have a stress fracture on my lower back, L5.
Oh, common. Go ahead.
And they said all I can do is rest. Is there anything a chiropractor could do to help?
Well, the short answer is yes, and the long answer is, of course, it takes a proper evaluation to know what to do with the stress fracture. There's different types. I would be willing to bet that the type of stress fracture you have in your lower back is called a spondylolisthesis. And what that is basically is where a part of the vertebrae breaks over time, sometimes subtly, sometimes it even elongates and not breaks, and then the vertebrae basically slips forward. And then what that does is if the vertebrae slips forward, the back of the vertebrae holds the spinal cord, and so it puts tension on the spinal cord and the nerves as well, and that can cause pain, discomfort, dysfunction, and all of the muscles are trying to pull it back to keep you in alignment. And so typically people that have that issue have a deepened lumbar curve. So working on your core is pertinent, but can ChiroCare help? Yes, we probably have no less than 10 of those active patients right now coming in on a weekly basis that have this condition. We've helped many. So great question. Further evaluation is necessary. It may be a spondylolisthesis. And yes, go to a chiropractor. Thank you. Next question.
All right, last question from me is
Right.
from Kenzie Ray4. Says, have you heard of Ehlers-Danlos syndrome or EDS? And have you ever seen a patient with EDS?
Excellent. So yes, I've heard of Ehlers-Danlos syndrome, EDS, and what it is, for those that don't know, it is a connective tissue disorder in where the tissues are more flexible, the skin is more flexible than, let's say, normal. And so joints can be very hypermobile. They can subluxate or go out of alignment very easily. So yes, I've heard of this, studied it, and yes, I've seen many patients with this. And what we want to do is a very thorough evaluation. This is one of the critical times that we would take an x-ray and look, and we would in fact do probably a motion study, because there are very, very few contraindications to chiropractic care. One of them is hypermobility. So of course we're not going to adjust a joint, first of all, that doesn't need it. Second of all, we're not going to adjust a joint that's already moving. And third, we're not going to adjust a joint that's moving too much. So yes, I've heard of it. Yes, I help many people with it. The way we do is we work at the truly subluxated areas that are hypomobile, they're not moving, to correct normal alignment, and then we work with strengthening exercises, with nutrition to give the body what it needs to be at its best. We can't necessarily repair the situation because it's a genetic disorder. However, we can optimize and fortify and strengthen the surrounding tissues and make sure the spine moves properly. I'm Dr. Jason. Thank you so much for tuning in. We're having some Instagram issues, so no questions from IG. Have an amazing day. Make sure you punch that subscribe button, and remember to stay ready, because health waits for no man. Time waits for no man or woman. Stay ready. I'm Dr. Jason.